March is Colon Cancer Awareness Month. In this week's podcast, we are joined by Dr. Michael Epstein to answer commonly asked questions about colorectal cancer risks and screening. Welcome, Dr. Epstein. Are there any digestive diseases or conditions that can put someone at a greater risk for colorectal cancer?
There are a few known gastrointestinal diseases and conditions that can put someone at greater risk for colorectal cancer and polyps. The first one includes chronic inflammation of the colon that's related either to Crohn's colitis or ulcerative colitis. And individuals that have IBD are recommended to have screening and surveillance examinations based on the duration of their disease and how long it has been present, and they should have biopsies for dysplasia every other year to look for precancerous changes that could lead to an increased risk of cancer. There are other greater risk factors as well, such as having a personal or family history of polyps or cancer. As we know, individuals that have a first-degree relative with either advanced adenoma polyps or cancer are at 2 to 3-fold risk of having polyps or cancer themselves. And of course, the younger the age of the relative when they have the diagnosis, or the greater the number of relatives, this would also influence the risk.
How common is colorectal cancer?
Excluding skin cancers, colorectal cancer is the third most common cancer diagnosed in both men and women in the United States. The American Cancer Society estimates for the number of colorectal cancer cases are 140,000 new cases of colon or rectal cancer per year. The rate of people being diagnosed with colon or rectal cancer each year has dropped overall since the mid-1980s, mainly because more people are getting screened and changing their lifestyle-related risk factors. From 2013 to 2017, incidence rates dropped by about 1% each year. But this downward trend is mostly in older adults and hides the rising incidence among younger adults since at least the mid-1990s. From 2012 to 2016, it increased every year by 2% in people younger than 50 and 1% in people 50 to 64.
I'm over 50 and healthy. Why should I get screened?
The most important reason for patients that are age 50 or older getting screened for colorectal cancer is that the cancer is preventable. If polyps are seen during a colonoscopy and removed, the majority of colon cancer can be prevented. And if cancer is detected, oftentimes it's picked up at an early stage when it is treatable and curable. In regard to the age you should begin screening, the American Cancer Society has guidelines for colorectal cancer screening and recommends people at average risk for colorectal cancer begin screening at age 45. In the most recent guideline updates, the American Cancer Society lowered its age to start screening because studies show colorectal cancer among people younger than 50 are on the rise. American Cancer Society experts have determined that screening starting at age 45 could help save more lives.
If you're new or returning to Your Gut Companion, learn more by following us on our social media or by exploring our website at dda.net.